Today we're honored to have Susan Tucker in from the Oklahoma Health Science Center. She's the Assistant Dean of Student Affairs for the Allied Health College. And she's going to talk today about the various careers in allied health and some of the aspects of them. And I believe you'll field some questions as well.
Yes.
So if you guys have any questions about fields, applications and such, this is probably a good time to ask.
All right, super. Thank you so much. It's always a pleasure to be on your campus, and I appreciate the opportunity. There is a handout, so those of you that snuck in past the young lady in the back who's in the hot seat who was helping me, be sure and pick one of those up if you need. Okay. I am, as Dr. Wickham said, from the University of Oklahoma Health Sciences Center, which is comprised of 7 colleges, and the College of Allied Health is one of those colleges. And so what my plan is tonight is introduce you to the various professions, and those are all briefly described on this handout. I'll refer to this handout a bit in terms of the degrees we offer, preparation for that, and then we'll talk about the demanding professions as well as the salaries that are the averages, the going salaries now for the allied health professions. We're informal enough, and I talked to a few of you about your majors, so if something comes up and you have a question about something I'm talking about, don't hesitate to raise your hand, and I will answer your question as we go. The College of Allied Health, as I mentioned, is one of 7 colleges at the University of Oklahoma Health Sciences Center. Allied Health has campuses in both Oklahoma City, which is where we talk about the location of the Health Sciences Center, Oklahoma City. We also have a campus in Tulsa, the OU Tulsa campus, which has a lot of the liberal arts degrees as well as some of the health professions are offered on the Tulsa campus also. College of Allied Health offers physical therapy, occupational therapy, radiography, and sonography in Tulsa. So we have 2 campuses. All of our programs are offered in Oklahoma City, and then 4 of them are offered also in Tulsa. So that's really nice to give some options for students in Oklahoma pursuing those degrees. Now, the way that I think is helpful to think about these allied health professions are in these categories that are on your handout, and how the professions are organized on your handout. The first group are the diagnostic professions. So when you hear the word diagnosis, or you think about someone who's making a diagnosis, what does that mean to you?
Tell you what's wrong.
Yeah, tell you what's wrong. They're figuring out what the problem is. They're trying to detect what could be the patient's issue. So diagnostic professions then are those that are probably working with a lot of technology, and of course have patient care because it is a health profession, but are working to try to figure out what the problem is to help make that diagnosis. This group of professions, just knowing that, sometimes appeals to those of us that really don't like a lot of people interaction. We're fine with it, but we really like the technology. We really like the detective work. We really like trying to figure out what the problem is. And so if you know that about yourself, or you're more interested in professions that are using a lot of technology and keeping up with those advances, this group of professions might be more of interest to you. On the flip side, we also have the therapeutic or rehabilitation professions. So therapeutic means a therapy type of relationship, a one-on-one relationship with a patient. Typically, over time, you will get to know that patient very well. They will be in your space, you will be in their space. They might drip or drool something on you. Not intentionally, but that's the level that you'll be working with that patient. So if you really like people, you may know automatically, oh yes, I'm really more interested in a therapeutic type of profession more so than a diagnostic profession. So that's how we have them organized to think about them. And I think is useful sometimes because you know your personality, you know the kinds of things you've been more interested in to kind of help you at least figure out, I can choose from this group or this group perhaps at this point. So when I introduce you all to these professions tonight, I'm going to follow the guideline of this handout. So we're going to start first with the diagnostic professions. And the first one listed is audiology. Someone tell me what an audiologist does. Just some simple definition.
Studies the ears.
Studies the ears.
Or diagnoses the ears.
Diagnoses
Stuff
the
with I
ears.
guess. That's what I would say.
Absolutely, you're right. Specifically looking at hearing, right? The ability to hear, or the magnitude at which there is a hearing loss. And so in this collage, I have a few pictures to illustrate some of the work that an audiologist does. So first, they're going to screen and detect for hearing loss. And we're fortunate in the state of Oklahoma that there is a mandate. So by law, an infant, that you see it in the left-hand corner, must be screened at birth. If you all remember from elementary school how your hearing was screened, what do you remember about that?
Wear headphones and then tell them when it beeps.
You're right, you wore headphones and you told them when you heard the beep. Maybe you raised your hand, maybe you clapped, whatever you did. An infant doesn't do that so well, right? So the audiologist uses electrodes actually that are detecting the brain activity that controls hearing to determine hearing intact or no. Well, why is that important that we do that at birth? What happens to an individual if they grow up?
Speech impairment.
Yeah, speech impairment, absolutely. And what else? We don't know they're deaf until they're 2? What happens? We've lost 2 years of communication, right? Probably would not take that long for the parent to realize this child isn't hearing. But the intent of it in Oklahoma is that early on we're detecting that because it has such an impact on communication, which is closely tied to success and independence in life. And so I think this is a great thing for Oklahoma that we test for this at birth so we know then we can get that child, if they do have a hearing loss, we can get them connected with services so that that can be restored. So that's the first thing the audiologist does. They're diagnosing that problem. The next thing they do is help restore any ability to hear that that person may need. And so if it's a child, and I've got a little guy in the middle, and he's actually had a cochlear implant, which is not done by the audiologist, that's done by a physician, but the audiologist works very closely with that physician in setting them up for that hearing aid or that device. The little girl in the lower right, she has a little tiny hearing aid. You guys probably can't see it on the slide. The gentleman, the older guy, has kind of a big clunky hearing aid, and I brought a sample of a hearing aid. You've probably seen these on grandma's or grandpa's. And then here's a tinier one that the audiologist then would fabricate or make these specific for that individual. So these aren't one size fits all that you buy at Walgreens. These are specifically designed and made for individuals based on their skin tone, the color that they want, the amount of amplification they need. So there's a lot of technology in designing the hearing aid specific for that individual. The watch up there is to show you an example of the advancements that they're making in the field of audiology and helping individuals with controlling the hearing aid. I don't know if you've ever been to church, is where I hear it the most, or some sort of quiet kind of event, and there are older people there, and the hearing aid starts buzzing. Has anyone ever been in that situation? Young people can hear it, and you're like, oh my goodness, that's awful. The older person, you know, they're just in their own world. They don't know. So they've got to take that hearing aid out, deal with the dial, get it back in. And it's just that they've had a maladjustment. It's not quite receiving the background noise or what they need to hear. So it's whistling and buzzing. Well, the watch is one way in which we can adjust for that. So they don't have to yank it out. They can adjust in the watch and tone that down or raise it up. So that's very appealing to patients. One, it's more convenient, and it's just a little less obvious that I wear a hearing aid, right, and I can control it here, where you wouldn't really know. So advancement technology, again, trying to appeal to the patient and make it really easy for them. And then I've got this random picture of a Miss America in the top right-hand corner. Does anyone recognize her? I'm pretty sure she was a Miss America when you all were alive, so I know it's been that recently.
I don't know her name, but she was deaf.
She was deaf, absolutely. Heather Whitestone, former Miss America, who was significantly hearing impaired. She had a cochlear implant. She was able to speak and communicate. The point is, very successful young lady who continues to do public speaking and inspiration, motivational talks around the country. But despite her hearing loss, she was very, very successful and has accomplished great things in her life. Largely thanks to an audiologist who was involved with that process for her. All right, so there's audiology, one of our diagnostic fields. Now, if we move on into the medical imaging or radiation sciences, and we have several majors within this broad category. Nuclear medicine is the first one. They're just listed alphabetically. So nuclear medicine is a diagnostic profession that is using a radioactive dye that's actually injected into the patient's body, and then we're able to see physiologically how the body responded to that dye. So that's a little bit unique in nuclear medicine in that they're looking at physiology versus anatomy, which you'll see some of the other professions are just focusing on anatomy. So nuclear medicine procedures take a little bit longer because the technologist has to watch what is the heart doing, for example, in response to that dye. What is the thyroid doing? Whatever organ system, whatever physiological process they're trying to help make a diagnosis in, they want to watch that process occur. I have a couple of examples of images in nuclear medicine so you can see the type of scans that they produce and the role that they have in helping make a diagnosis. And this is a PET scan. That's a type of tomography. It doesn't have anything to do with a dog or a cat, a pet, but it is an acronym for a type of tomography that they use in nuclear medicine. And this is anterior posterior of a human body, and it's cutting him off about at the chin, right below his knees. Can you all see that silhouette? Okay. And then he's got these spots on him, which is what we see in that nuclear medicine scan. The history, or what happened to this young man, is he had a lawn care business in Oklahoma, which in Oklahoma we're fortunate to have fairly decent weather. And so he worked all the time, outside all the time, taking care of lawns and his customers. And he developed this sore, this scab on his shin. And the scab didn't heal. It changed shape, it changed color, it had a discharge to it. It always just looked ugly, wouldn't heal. So months went by. He ignored it because he had work to do. And finally, at the urging of his family, he went to the physician. What do you think the physician suspected?
MRSA?
Could have been MRSA. If it's a skin lesion that changes color, doesn't heal, what else might he suspect? Some type of skin cancer? And that's exactly what happened. This young man, the physician suspected that, sent this young man for a nuclear medicine procedure because they wanted to see physiologically what's going on in this body. The dye in this particular instance is high glucose or high sugar base because the cancer cells will absorb that sugar much more quickly than normal cells. So they injected the young man with a dye, and it's just a simple needle stick, so relatively non-invasive. The dye goes through his body, the cells absorb the dye, and then we have a picture physiologically of how his body responded. Now, nobody in here is a nuclear medicine technologist, right? Right? But can you look at this and say, we have good news or we have bad news?
But
Yeah. It's pretty horrific news. Throughout his body, all of those spots that make him look kind of like a Dalmatian are suspicious cells. They have absorbed that glucose so quickly so that we can see that on the scan. And we have a really good idea now about the suspicious cells in his body and how widespread it is. So that's good news. We know what we've got, and we can act quickly to preserve his life. And so that's what happened. Then he was diagnosed and went on for his treatment and care of the cancer. So this is the power of nuclear medicine. Relatively non-invasive, a needle stick, a little bit of time. This guy at this point feels pretty good. He just knows, I've got this sore on my leg and it won't go away. He feels good. What he doesn't know is what's going on inside of his body. But now we have a diagnosis and we can get him some help. So this is how powerful nuclear medicine is in helping us make those diagnoses. And in this day and time when money is an issue, reimbursement is an issue, people's time is an issue, the less invasive we can make it, no hospital stays, no surgeries, minimal inpatient, outpatient procedure, and we can know this type of information, we've really helped that patient and we've saved dollars in our healthcare system. So nuclear medicine is a great field to help us make these type of diagnoses. If we move on to another diagnostic category in the medical imaging or radiation sciences, we can look at radiography. If you've had an x-ray, other than the kind that you get of your teeth at the dentist, if you've had an x-ray, tell me something you remember about having that x-ray done. Nobody's broken a bone in
Yeah,
here?
they put magnets down beside you sometimes.
And the technician has a.
Technician
Yeah,
leaves the room.
And they put like a magnet or something right there. I don't know if it was a magnet.
Okay, they put something beside you?
Yeah, like
What were
my-
they x-raying? Your
My
hand?
finger, the one time they would sit something like right here on a blackboard, and they would stick like a magnet,
Okay.
and then another time with my leg, they had me put on like a vest.
Okay, all right. And then they left the room. Did someone say something over here?
Lead vest.
Lead vest, you had that on as the patient? Okay, all right. Lots of protection, right? A lot of information he's recalling about the positioning. Do you remember if that person was a male or female? You remember if they had long hair, short hair?
Generally male, I mean female.
Generally male, could be
I mean,
female?
I meant female. That's what
Okay.
I just said. I was thinking male for some reason. I just saw something.
And it's really insignificant, isn't it? That who it was or what they did, except that they were kind to you, they took their time and they positioned you well, and they did everything properly. Because they're a diagnostic field, so again, this is illustrating you have patient contact, but you're dealing more with the images. And that's very common for a radiographer to be remembered for taking care of the patient, leaving the room. The radiographer is taking x-rays, they're taking MRIs, CT scans, mammograms, heart caths. All of those images are done by a radiographer. So there's a lot of employment opportunity in a variety of settings because of all of those images that belong to the profession of radiography. So there's a lot of diversity in the field. You're not just doing one type of scan all day long. You can, if you want, you can choose to do that, but you have skills to do many. So if we look at some examples of these types of images, here's a lung CT, and CT, in essence, takes slices of tissue. It doesn't actually slice it, but the technology is giving us pictures of slices, which is very helpful because we can see what's going on inside of a structure. In this particular case, this patient was having lung issues, and the CT scan then shows us a picture of lung. And just to give you some orientation, this would be the lung tissue. The yellow is bone, and this is the sternum. So the patient is lying on his or her back, and then we're seeing right and left lung tissue. And again, none of us are radiographers in this room, but we can notice some things about this that we would have questions about, wouldn't we? We know that we have two lungs, and shouldn't they look the same? And so we have some problems here. You can see that this one is kind of eaten out, looks like a sponge, but this one looks like it has a lot more porous type of value to it than the other side. And then this red and white splotching certainly doesn't look like what's on the other side. So through radiography, then, now we can see some problems with this particular patient's lung tissue. That's so helpful in making the diagnosis, so the physician can look at that and say, absolutely, this is what we have, and this is the treatment that we can get for the patient. This is a mammogram, and we've got some labels on here just to orient you to that breast tissue. And here's the mass. And probably if I asked you to sit there, if I didn't have those labels on there, and I asked you to sit there a while, you would probably notice that area is wider than the rest of it, and you may think, well, that looks odd. Sometimes the mammograms are not this obvious, and so the radiographer has to be someone who's very detail-oriented, who's very patient at looking at these scans and images to determine what the problem is, because your ability to see it or not see it, whether it's a fracture, a mass, something abnormal, may be the difference between that person's life or end of their life in some way, if you're not making that diagnosis at the appropriate point. So that's a mammogram. This is an MRI, and if you've ever had a knee issue or know someone who's had suspected torn ACL, for example, they likely have had an MRI, and that gives us the best image of anatomy that we can possibly get. And this is normal knee, but you can see all of the structures very clearly through the MRI. All right, sonography is another one of the diagnostic professions in medical imaging and radiation sciences. You probably are familiar with sonography or ultrasound, and those two words are interchangeable. They mean the same thing. We're talking about the same profession that in essence is using sound waves to give us an anatomical picture of a structure. You're probably very familiar with a developing fetus, and that pregnant mom would go have an ultrasound or a sonogram of that baby. The sonographer is looking for normal development of that infant while it's in the womb. So they're taking lots of measurements. They're looking for things such as 4 chambers in the heart, the appropriate number of fingers and toes, the head growing in proportion to the body, etc. So they're looking at those normal developmental milestones when they're looking at that developing fetus. It's much more than looking at babies, however. There are lots of images that we can use through sonography to help make a diagnosis that will save our patients some time and get them treatment that they may desperately need. There are some invasive procedures with sonography. Sometimes we have students say, I really like sonography because there's no blood and nobody's ever sick and you don't ever have to stick anyone with a needle. And while for the most part that's true because it's an external procedure, you have a transducer that you're rubbing on the patient's body with some anti-friction gel, there are some invasive procedures. So I'll just leave it at any hole in your body, a device could go in there to get a picture. We'll just leave it at that. But that's how invasive that these procedures sometimes can be to help us see what's going on inside of the patient's body. Here's an example of using ultrasound to look at blood flow through a vessel. So for example, if we have suspected blockage of the carotid artery, we need to know very quickly, is it blocked, the significance of that block, because what blood supply does the carotid provide? To what organ? The brain. It's important that not be blocked, right? So the physician may order an ultrasound of that carotid artery to look at blood flow. Typically, you're going to see a band of red and a band of blue, and it's just going to be like a stripe across the vessel. So we can see in this one is abnormal. There's a psychedelic kind of swirling action there. So this alerts the sonographer, yes, there is some type of blockage and they can do further testing. Another example of an ultrasound or a sonogram, this particular patient had gallbladder problems. They weren't sure what was going on but had symptoms of gallstones. So the physician ordered an ultrasound. Sonographer performed that and here is the gallbladder, and inside, which kind of looks like a turtle, can you all see that shape, is a gallstone. So quickly we make the diagnosis, patient gets treated for the stones, and they feel better. It's really important in sonography that our students learn, of course, anatomy, but surface anatomy also. So when we are teaching and the students are learning about anatomy, they of course are working on a human cadaver and learning about the interior anatomy, but they have to know external or surface anatomy for this reason. So if you have a patient and you know, I'm going to do an ultrasound of the gallbladder, where do you start? Do you start upper quadrant, lower quadrant, leg, neck? Where is it? You know, that's what you have to know, because you can't just be fishing around all over the patient's body until you hopefully find the organ that you need. Sometimes it's a real challenge for our students, and we work a lot in labs so that we get comfortable with that. You don't walk in sort of searching for the structure that you're looking for, that you're going in with confidence knowing that surface anatomy. And this is a good example of finding that gallbladder. And then here is a fetal ultrasound, so you can see the kind of detail. This is the forehead, you see the nose, and the lips, and this little chin. There's quite a bit of detail that you can get in ultrasounds of babies now. People are looking at them and saying, I see myself in this baby, or I see Uncle John, or whatever. So lots of detail that they can get. And of course, the sonographer is looking at it from a health or anatomy or development perspective. All right, if we move into now the therapeutic professions and look at nutritional sciences, which if I'm studying nutrition, what is the health profession or the allied health major that I'm likely pursuing? You know what the title of it is? Do you know what the profession is called? I want to be a dietitian. So that's the term that our students are preparing for when they come into our programs to learn more about nutrition. They want to be a registered dietitian. Well, what is it that a dietitian does? Who needs the services of a dietitian?
Cafeterias, hospitals, and
Yes, cafeterias and hospitals.
diabetics.
People who are diabetic. Anyone else?
Athletes,
Athletes?
celebrities,
Say it one more time.
celebrities, and actor and actress, celebrities.
I'm not understanding. I'm sorry.
Celebrities.
Celebrities. Celebrities who want to gain weight, lose weight, you mean?
Yeah.
Eating disorders? Yes. Okay. And those are pictures of what I have represented on this collage or this slide to help us think about the variety of ways in which a dietitian works. So let's think first about people who have some sort of illness, who their health is affected by the foods that they eat or not eat. So that might be someone with diabetes, it could be someone with high blood pressure, cardiac disease, high cholesterol. They also work with people who need to gain weight or lose weight. What do we know about the weight of America now? We're getting big, aren't we? So that's good news for dietetics. That is good news for dietitians. They can be a part of that health and wellness piece to sort of change that, help people. Dietitians can also work, as she mentioned, in hospitals, cafeterias, any industry that's providing large quantities of food, because we have to have balanced menus and options for our customers. So cruise lines, universities, public schools, they will all employ a dietitian to help them with that meal planning. And it may be for the large aggregate, or it may be for a small group, like just the athletes. Or in a hospital, just the people on the burn unit, for example, will have a dietitian that's overseeing their menus and the calories that they're intaking. Dietitians can also work with people who have eating disorders. They're part of a team that actually helps individuals that need to gain weight or having problems with food. And they can also work in industry that invents food. And what I mean by that is, you know, for a while on the market, probably when you all were little kids, there were things like blue butter, green ketchup. Do you remember those things on the market? Did your mom ever let you buy those? No? Yeah, some moms yes, some are no. Why do we like those crazy things in America? Peanut butter by the slice, that was another big one for a while. Some of them for a convenience standpoint, right? Peanut butter by the slice, they really thought this is gonna save people valuable time. Because you can slap that piece of peanut butter on your bread. It was like American cheese comes in a little cellophane wrap. It was just like that, and was brown. Put it on your bread, you're good to go. You didn't have to get the jar out, you didn't have to get a knife out. Put the peanut butter on, plus it helps with the portion control. We're not putting half the jar of peanut butter on our sandwich, we're just putting one little slice. That didn't really catch on, I don't think you can buy it anymore. But that was for a convenience thing. But blue butter, green ketchup. But the important thing is that a dietitian was involved with that, and how do they have that knowledge? It's their chemistry background. They have a lot of chemistry in their training, and they understand those chemical reactions and how our body uses the food for fuel and energy so that they can make those kinds of decisions to make food that tastes good. Our students have a foods lab in nutritional sciences where they're actually experimenting with different types of recipes and different types of foods. So they may have a challenge to make a cookie that is high in fiber, low in sugar, low in fat, no chocolate, that still tastes good. So they have a challenge to try to come up with that. Or alter a recipe for someone who needs no gluten in their diet. So alter a favorite recipe. So we have this giant kitchen. It kind of looks like Rachel Ray's kitchen, not with all the cameras, but anyway, it's really cool that they have all these things available to them to experiment with food so that they can be prepared to help clients who may need that kind of help. There's a lot of education involved in nutritional sciences naturally because it's therapeutic. You have a relationship with your patient or your group of patients. So dietitians will use models of a variety of things. I brought a model of something that a dietitian may use in working with a patient. What do you think this is a model of? Yeah, I heard it, fat. I have been asked if it's earwax, and no, it's not earwax. It's a model of human body fat, and if you've worked with a cadaver, it really kind of looks like this. This is made out of rubber, so this is not actually that. But it looks like this. This coloring has the blood clot, little red spots on it, just like this on a cadaver. But this illustrates human body fat. Now, how many pounds overweight would I be if I had this much fat hanging on my body? And not like it's just right here. Let's liposuction it out. I have this much extra fat in my body. How many pounds overweight am I? 5. Who said 5? You win the magic prize. That's right. 5, and I get this much fat? That can be discouraging, right? How many of us in America are 5 pounds overweight? A few of us, right? How many of us are 10 pounds overweight? So then we got 2 globs of this. So this could be very motivational to a patient to show them this is what we want to rid your body of. We could also have a model of muscle. We want to show them this is what we want to exchange this for, is muscle. And then we can let them make a necklace out of this or put it on the refrigerator as a reminder or something, right? But they also use models of food to help people with portion size because we get tricked into that. Because if we go to Wendy's, we can get everything biggie for cheaper. So naturally, we want to do that, but what we don't realize is the extra calories and fat, etc., that we're getting in those items. And so that's why restaurants actually have used dietitians to help them provide their customers with the amount of nutrition in all of their menu items. So any Subway, Wendy's, etc., you can get information about menu items in terms of their nutritional value. And that's thanks to the work of a dietitian. So there's lots of education, lots of ways in which dietitians help people make changes in their diets and the food choices that they make. Does anyone want to hold my fat? I'm happy to share it. Pass it around. She said best. I would toss it actually, but it's kind of a chunk. She said, ooh. All right, so that is nutritional sciences. If we go on to another one of the therapeutic or rehabilitation professions is occupational therapy. Has anyone ever heard of an occupational therapist or an OT? Yes? What is it that an OT does?
Sort of like improve people's living, just
Improve-
the quality of life, pretty much overall.
Okay, improve people's quality of life overall. I like that. Very good. Now, how do they do that, and who do they do that for?
People with disabilities.
Or in everyday activities.
People who are disabled who can't do everyday activities. Absolutely right. So that could be anyone through the age span, right? An infant who is born that cannot roll, for example, cannot begin to reach for toys and interact with mom or dad, up through an elderly person who has had a stroke and they cannot dress themselves, they cannot drive their car, they cannot go to bridge club. They're robbed really of those activities that are so important to them before they had that stroke. And lots of examples in between. And occupational therapists also work with people who have mental illness. So again, people with disabilities who can't do their basic activities of daily living, the basic activities that are sort of boring, really. We don't talk about, guess what, I went to work today, guess what, I got dressed, guess what, I ate, until you can't do it. And then it becomes really important because it's changed your life when someone has to do that for you. So if you have a mental illness, such as schizophrenia, you know, maybe you believe that half the time you are a celebrity. You believe you're someone famous. And the other half the time, you're fine with being a student right here at Northwestern. So that's really difficult to go through your day thinking you're someone else. So with that kind of mental illness, then you have problems doing those daily activities, just as you would if you had an amputation of your dominant upper extremity, a physical injury that's limiting your ability to do daily activities. So that's what occupational therapy is, and thank you all for helping build that definition. I brought a tool that an occupational therapist may use to help someone do a basic activity of daily living. Now, OTs like to create things such as this. So if someone presents with a problem, they cannot do whatever it is in their life that's important to them with their limitation, the physical or mental disability, the OT will work to try to change that. Figure it out. How can we help them be independent and successful? So this is an example of a piece of equipment that an OT might use. It's hard plastic, but it holds its shape. It has these big ropes on it. Any guesses to what this may be?
Does it aid in helping you tie your shoes?
It aids in helping you do something that is very near your shoes. Yes. Good. Good start.
Put your foot in the shoe.
Say it again.
Put your foot in the shoe.
Put your foot in a shoe, like a shoehorn. You're warm, but you're not there. There is such a thing as a long-handled shoehorn, though. There's shoehorn, and then they just put a long handle so you can reach it easier. Any other guesses? How about my girls? We've heard from two guys. And they're really warm. What did it say?
Does it shave your leg?
This is nothing sharp on this.
Yeah, like you can hold the ropes with your teeth and then.
It's a Thursday evening.
Might help you in lifting your foot.
It might help you lift your foot, Close. I mean, you're very warm. This has something to do with the foot and putting something on
Your pants.
Oh, it's a sock. You put the sock around it. Yeah, there you go. You put the sock
Right.
around it and then you put your foot in the sock and then
That
you
is-
slide it out.
That
It's
is
like a sock
exactly
board.
what you do. That's exactly what you do. Did you have like a nightmare about this or something? How did you do this?
No, someone said sock and then I remembered what those are for.
It has a dorky name. It's called sock donner, sock putter-oner, and that's exactly what you do. If someone cannot bend down and reach their foot to start their socks, put their sock on, and maybe it's because of a hip replacement, a back problem, arthritis, you name it. There are a variety of reasons why someone can't get to their foot to put the sock on. What we do is we put the sock on the donor, and so the toe of the sock is tied against the end. The patient would be seated, and they hang onto the ropes, throw this down on the floor, stick their foot in there, and voila, sock is on their foot. They didn't bend down. And at first it's ugly, you know, it's like, ugh, I halfway missed my foot, it's not quite on there, but it gets better, and then the patient's independent. So what? Well, if it's your choice between your mom or your roommate or wearing no socks, maybe you'll try the sock donor, right? It's just an example of a million pieces of equipment that an occupational therapist might use to help someone be independent, which can change your life. You know, think about the things that you do to your body and the things that you do in private to yourself to get ready for the day, and if someone else had to do them, it just robs you of your dignity. So it's occupational therapy who restores that and helps people, regardless of their age, regardless of a physical disability or mental illness, be independent again. All right, physical therapy. Now I know several of you are interested in majoring in PT, or physical therapy. But did you know that PT doesn't just stand for physical therapy? It stands for pain and torture. So remember that someday when you're providing therapy. I'm just kidding. What is it that a PT does?
Rehabilitate.
Rehabilitate you. Who? What's wrong with me that I need physical therapy?
Someone injured.
Someone injured?
Yeah, when I tore my ankle, I had to go see a physical therapist.
Okay, all right, so an injury that limits your mobility, right? Physical therapists are movement scientists in essence. They are experts in what it takes for a human body to move, whether that be a simple recovery from, let's say, a shoulder sprain. We won't make it like a dislocation or torn anything. We've lost use of that shoulder, so the physical therapist is going to rehabilitate us so we can use that shoulder. It can also be a child who is born with some sort of physical disability, such as cerebral palsy, spina bifida, that forever will limit their mobility. So they're working with that child from day one and helping them be mobile. Or it could be someone who has acquired a life-altering disability that will again forever affect their mobility, such as a soldier who lost his or her leg in war. It's going to come home, be fitted for a prosthesis, and from now on, they're going to be wearing a prosthesis to drive their car, to go snow ski, to go to class, whatever it is that's important to them, and access their world through their mobility. The physical therapist is there to help rehabilitate and help them get back to that goal. PTs use a lot of tools to assess or evaluate their patients. This is an example of a tool that may be used. And those of you that have had physical therapy, you've been a patient. Did your PT use anything like this on you? Or what were they doing?
Measuring your range of motion.
Measuring range of motion, right. The available motion that you have, or movement that you have at a joint. So they wanted to measure that. Why? To
Progress.
torture you, right?
See your
Figure out
progress.
what exercises I want you to do to help you get moving and do it.
Right. See your progress to determine what exercises to do to help you regain that motion. Likely, they compared your good and your bad, right? And you're probably thinking, no, I'm fine over here. This is the problem that I have. But the reason they wanted the right versus the left, or the good versus the bad, is so that they know what's normal for you. And they can try to get that weak side back to the strong side. They also are experts in knowing how much range of motion we need at each joint or movement to be functional. So for example, if I have torn an ACL, so I have a knee problem, and I tell the physical therapist, well, I have to go up steps and I have to sit down. They're gonna know immediately how much range of motion functionally is required to go up a step or to sit down, right? It may not be complete flexion, complete extension to match my other knee. That's ideal. But functionally, I may not need quite that much. So they're gonna help me be functional with the amount of movement that I have so that I can move around and go where I need to go and do what I need to do. So they're experts in every aspect of movement, and they assess that and evaluate range of motion, flexibility, strength, endurance, those kinds of attributes to help a person be maximum in terms of their performance and their potential in movement. So that is physical therapy, and again, they work through the age span from birth to geriatric and everything in between. Radiation therapy is another one of the therapeutic fields, and radiation therapists are the professionals that are working closely with individuals who have cancer. So they're with that patient delivering radiation when they're in the fight of their lives. There is every hope at this point in that patient's progress, and they win those fights over and over and over. So radiation therapy is the individual that's delivering radiation, which is different from chemotherapy. So the radiation therapist will use equipment such as you see on this particular slide. The linear accelerator in the top left is the equipment or the device that delivers the radiation. And it's called linear accelerator because it moves forward and back, and it also turns, so that beam is coming down but being forced to go at different angles. That increases the effectiveness because we have angles going at multiple directions to our tumor. For example, if you want to think of it as a tumor and then it's being hit from multiple directions, it's going to be more effective than if we're just hitting it at one direction. So that's what the linear accelerator does. Now you may also notice on the right-hand side, that looks like an x-ray, which was radiography, and you're right. The radiation therapist may use the results of the x-ray to help design and plan their treatment for radiation. So you can see this border on this person, which is upper chest. The green is a large area, and then we've got this red, smaller area. The red is where we will want to deliver the most intense radiation in radiation therapy because that's where our tumor is located, the area we're most concerned about. And we want a lesser intensity of radiation here because we don't want to destroy any normal tissue, but we're very concerned about metastases or spread here. So we're going to plan a treatment that's intense in the red area and less so in the green. So the patient comes in and they're going to be lying on this plinth, and the radiation comes down through here, and this thing goes forward and back and it spins around. Now, how do we make sure the patient lies still, one, and gets in the same spot, two, every time they come for therapy? Because that's important, right? Radiation doesn't discriminate between healthy tissue and bad tissue and stop when it gets to healthy tissue. It's going to go where you send it. It's very important in radiation therapy that our patient is positioned the exact same way every time. How do we do that? We position. What?
Make a mold or something?
Make a mold, absolutely. Here's an example of a type of mold that we could use. Now you can see this is very flimsy. And it's a mold of a face, and you kind of see that profile of the face. Kind of, here's the nose, the mouth. And this is, you can see through it, you can breathe through it. And then it has this frame with holes in it, so that would be mounted to the plinth, the table, that the patient could still see and breathe. And it's all pulled out like this because their head is going to be on a pillow. And we'll let them be comfortable for this. So this is bolted down. Aha! Now we have their head in the same position every time, right? So if we're doing radiation in this area, we know they're not moving. They're going to be in the same position every single time they come for radiation therapy. We can do similar things for any other parts of the body. So we can position the trunk, the legs, the arms, similarly, so that we always deliver that radiation in the same spot. Critically important to the type of care that we're giving. The radiation therapist doesn't stay in the room while this is going on. The radiation therapy unit it has lead walls that are about 2 feet thick, and of course the therapist goes out of the room and locks those doors while the patient is in for their therapy. They can talk to the patient, they can hear the patient through the ways in which they engineer these rooms, but they're not in the room. So it's really important that that patient be positioned appropriately and stay still for the procedures. The gamma knife is a type of radiation therapy that is used for inoperable brain tumors, and there are several gamma knife facilities throughout Oklahoma and of course the nation, a part of radiation therapy specifically for brain tumors. This is a type of radiation therapy that is a little unconventional in that it is not exteriorly being projected into the body, but this is actually in a surgical suite. You can see exposed brain, and this bulb and catheter system is a part of radiation therapy where we're delivering radiation deep inside the tissue of that brain. So there's so many ways that we can get really aggressive and help people in these fights through what we're able to do in radiation therapy. And then prostate seed therapy is very effective in working with gentlemen who have prostate cancer who cannot, for whatever reason, go forward with the surgery to remove the prostate. So that could be their age, their health condition, the other responsibilities that they have. They cannot have any sort of time off, really, or risk of disability with the surgery, so they may opt for the seed therapy. And in essence, those tiny granules that look like rice, really, are injected into the prostate, and they act instantaneously. It's not something the patient feels or is terribly uncomfortable, and then that is working against the prostate cancer. Very effective, and then forever that gentleman will have a nice picture of those seeds, but it really works to slow the progress of the cancer in the prostate. So that's radiation therapy and their work. And then the last of the allied health professions in the therapeutic area is speech-language pathology. Speech pathologists work with who? What kind of a person would need services by a speech pathologist?
Like little kids with speech impediments.
A little kid with a speech impediment.
Somebody who can't talk after a stroke.
Someone who cannot speak after a stroke or a head injury, because the area in our brain that controls our speech and our communication has been damaged through that stroke or head injury. A speech pathologist would be called upon to help in that recovery. Someone who speaks for a living or uses their voice as a part of their livelihood. So it could be a cheerleader, could be a public speaker, could be someone who sings for a living, ways in which they can minimize any damage to the vocal mechanism and then rehabilitate them should there be a problem. I brought an electrolarynx as an example of one type of tool that a speech pathologist may use, and this would be for someone who has had that voice box removed. So they have no voice, they have no way to produce a sound, they still have vocal cords, so they would have to talk using electrolarynx. So let me ask you a question, see if you can tell what I'm saying.
Tonight?
What did you have for dinner?
Yes, you heard, understood me. So if this was what I was left with, you know, this was my only way to speak, the speech pathologist would work with me to learn to use this appropriately. Now, I would always kind of sound like that because that's the tone of this particular electrolarynx, but you might have heard these if you've been in Walmart or Chili's or something, and you're like, wow, did you hear this? Sounds like a robot or something. There's someone using an electrolarynx, so they're more common. People are more comfortable out there. But if this is the difference in you being able to verbally say to someone, I love you, or go to Sonic and get your Route 44 Dr. Pepper or whatever, rather than buzzing and writing a note, you'd probably adjust to it, right? If you ever wonder what it's like not to be able to talk or communicate, just say, okay, for the next 5 hours of my day, I'm not gonna talk. And just see how it isolates you, it changes your personality in some ways. And so this gives people voice back. And so if this had happened to me, I would come to you tonight and I'd do this entire presentation sounding like this. And you guys would be like, oh, I wish she'd go away. Anyway, electrolarynx, and you're certainly welcome to play with this and talk with that a little bit too. So those are the professions. Speech pathology, working in hospitals, in public schools, in rehab centers, throughout the age span, and working with people who have communication difficulties. So that might be language or speaking delays. It may be the receptive communication. They may not understand what's being said to them, and helping them recover and be effective in their communication. The training for these professions is on your double-sided sheet, and what we provide on here are the degrees. Some are bachelor's degrees, meaning it's a total of 4 years of school. The way the Health Sciences Center is structured is that all students transfer to the Health Sciences Center at some point. So if you're coming in for a bachelor's degree, likely you do 2 years of prerequisites at Northwestern or any university, transfer to the Health Sciences Center and complete your degree. If it's a master's degree, typically you're earning a bachelor's degree coming to us. If it's a doctoral degree, then you're typically earning a bachelor's at a minimum, maybe a master's before you're coming to us. So that's really neat about allied health, is that there are bachelor's degrees, master's degrees, and doctoral degrees. So sometimes we make decisions about the healthcare profession that we want to go in by how much we want to be in school and how much time and money we want to dedicate to pursuing that degree. So you have lots of options in allied health for different types of degrees. The demand for the professions, according to the U.S. Department of Labor, which looks at what's going to happen to professions over a 10-year window of time. And they do this for all sorts of trades. So you can go on there and see what's going to happen to shoe shiners and airline pilots and everything. I just pull it for these allied health professions that I've talked with you all about. So first of all, we want a positive number, and then the bigger the number, the better. So in essence, this is very good news for all of these allied health professions. Over this 10-year window of time, we're going to see a positive change, and fairly significant in some of them. Well, why do you suppose these projections are so high, such as for PT and OT?
So it requires so much schooling.
What?
It requires so much schooling, so not as many people undertake the, you know what I'm talking about?
Yes, okay, so she's saying that because of the schooling and requiring more, such as physical therapy has transitioned to a doctorate in our country, not as many people will pursue the profession, so it makes it in greater demand. That may be part of it, absolutely. U.S. Department of Labor is looking at that. What's happening to the customers or the clients that we may be serving in OT or PT? Are there going to be more of them? Why?
Children of the baby boomers are getting older. Need PT and occupational therapists for them.
Okay, so the baby boomers, the children of the baby boomers?
How do you refer to that? I would say the babies born during that period are getting older.
Right, right. So the baby boomers are getting older, and the baby boomers, there's a lot of them, right? A large number of people that are getting older. What happens as we get older to our physical abilities and our ability to do things for ourselves? It starts to kind of go downhill, right? So absolutely, that's affecting these rehab types of professions. What else can you think of that's affecting the demand for health professions?
A lot of them are baby boomers that are going to quit working in that field.
Right, so baby boomers that are working in these professions are retiring. So we're having a need, a higher demand for people to re-enter the youth of the profession. Right. The effects of the war always affect a health profession, and rehabilitation is a high profession that is most affected by the war because of the traumatic injuries. Also, the advancements that we have in helping babies that are born far too early, preserving lives. They're born way too early, the development is way behind, so therapies will help those children progress along. So those are just a few examples. And many of these related to technology, it's the same thing. Technology is advancing so quickly, it's increasing the demand because they can do so much more. The professions that help diagnose, they're diagnosing quicker and easier and cheaper. That affects the demand. So you can't go wrong by going into an allied health profession or any health profession for that matter because of all of these factors and more that influence the demand. Salaries, these are averages from the U.S. Department of Labor, and I like to look at their site because it's an unbiased look at what's going on at a moment in time in the United States of America. This is not just new graduates, it's not just people who've been working for 40 years. It is an average for everyone out there at that moment in time. And you can break it down on their website. You can get Oklahoma County, you can get state of Oklahoma, you can get Texas, you can get all sorts of ways you can break it down. This is nationwide average. So you know that it is reasonable, you will be making this amount of money in your lifetime as a professional in one of these allied health professions. You may make much more, you may start at much less, but you can expect to make this amount of money. Now, you can see nobody lives like Bill Gates, but you have a very decent quality of life with any of these professions. And remember, some of these are bachelor's degree programs. So after 4 years of college, you can expect to make $77,000 as a radiation therapist. Is that good money? Pretty good money. Right. And think about the rewards that you have at the end of the day. In healthcare and in these allied health professions, you've made a difference in someone's life. Not only you're driving home in your nice car to your nice house and wearing your nice clothes, that quality of life, but you've changed someone's life. You have helped them by diagnosing a problem. You have caused them to be able to feed themselves, whereas the day before they could not. So it's really rewarding in terms of the work that you do in helping people continue to live their lives to the fullest. So that just gives you kind of an overview of salaries. Admission requirements for our programs. There is a lot of detail on our website, so I'm not going to bore you with every single aspect of the admission requirements, but just to give you an overview that they all require a set of prerequisites, and again, you can earn all of those right here at Northwestern. They all have minimum GPAs, and the GPAs, the higher the better, the more competitive you are. You've heard that before, so the better you take care of your grades, the more competitive you will be. There's always a minimum and a cutoff, and you really need to be above the minimum to be competitive. Occupational therapy and physical therapy require 40 hours of observation. They require that. It's a good idea to do it in any profession or any major that you're thinking about, just so you have a perspective of what would it really be like to work in that field. I'll give you an example. I had a student a couple of years ago who was interested in sonography. And I recommended you need to go out and shadow and observe what a sonographer does. So she did, and then 2 weeks later she came back. It was on my calendar again, and I said, "Oh, it's great to see you. Why are you back?" She said, "I'm not doing sonography." And I was shocked because she just said, "This is what I always want to do. I'm going to do this." She said, "When I went and observed, the work that they do is in the dark all day long." And I'm like, "Of course. You got to see your image." She couldn't do that. She didn't like that isolation and darkness. I didn't think to tell her that that work was in the dark, but it mattered to her, so she changed her major and lived happily ever after, I'm sure. But that's a thing that, that's something you'll observe in your shadowing of these professionals that may be a hit or a miss for you. So it just gives you a perspective, and the professionals will welcome you. They want to share what's going on in their fields with prospective students. Some of our programs require the graduate record exam, which is a standardized test to look at aptitude or ability to go to grad school or professional school. You'll want to take that fairly close to the time of application. And then we do have an early admit program where students have outstanding GPA and meet all the criteria. and occupational therapy and physical therapy. So those are kind of like automatic admissions. If you meet that criteria, you are automatically admitted. So that's an overview. You can get all of this in detail on our website, and that URL is on your handout. Now, in terms of application procedure, deadlines are in the spring. It's an online application. Same criteria apply, just as when you apply to colleges and every scholarship you've applied for. Make it thorough, make it on time, give it your best shot, be sure and follow the instructions to a T. And it's really pretty simple that it's all online. The applicant pool, and this is for 2010, 2011 obviously is going on now. They're finalizing all of those decisions and class sizes. The admitted number is a relatively fixed number. We're going to have the same number of students in every single class that starts in the fall every year, or summer. Some of our programs start in the summer. So that number is not going to change very much from one year to the next. And of course, the applied number can vary significantly from one year to the next. So I showed you this slide to motivate you. So you can see some of our programs are really competitive. Physical therapy, sonography, very competitive. So that motivates you. Do well in your classes, be a leader on campus, study for that GRE, do your observation, do everything you can so that you'll be one of those admitted. This also gives you information as a backup plan. You know, maybe you've heard something tonight, or you want to do some more research into another profession that might be a good fit for you if what you're thinking you want to do right now doesn't work out. You can apply to more than one and look at the ones that aren't quite as competitive, but they're related, or there's a lot of similarity in those professions. So that might be something to think about also, information from this slide. What kinds of questions do you have? Are there things that you were dying to know about that I didn't tell you?
This is what it sounds like when I ask them this question too.
Those of you that are interested in physical therapy, any questions? Are you close to applying? Are you curious about what should your major be as a pre-PT? You got that nailed down? You know you have to have a bachelor's degree now to apply to physical therapy. It's a doctorate program. And my suggestion for that is choose a major that is of interest. One, because you need to do well in it. You need to be competitive with your GPA. And choose a major that closely aligns with the prerequisites, which are heavy science. And choose a major that could perhaps be helpful to you as a backup plan if you don't get in the first time you apply. Absolutely never get discouraged if you apply to one of these programs and you don't get in the first time. It happens to a lot of us. And we're there to help. If you don't get in the first time, we talk with students. We try to figure out ways that you can strengthen your application when you apply again. Because you don't want to be deterred of pursuing a health profession if that's really what your passion is. And that's why we're there to help you. So that would be my advice for pre-PT majors. Some of you mentioned the medical imaging, and you don't have to have a major, of course. You can come in with your prerequisite hours and come to us and finish that bachelor's degree at the Health Sciences Center in the College of Allied Health. But again, you may want to select a major as a plan B, something that you're interested in if you don't get in. I think it's helpful to be involved in campus, meet different people, work with people on projects, take advantage of opportunities to work with people with disabilities or a little bit different than you. Not that you have to have a job in a nursing home or a hospital, but get on committees that are doing something that maybe you've never done before, where you have to get to know people that are of a different culture or grew up very differently than you. That just helps you in your people skills, your ability to interact and come to a consensus about things. Helps in your leadership. Get to know your professors. They have good advice for you. They'll help you if you're struggling in classes so that you can keep your grades up.
I have a question. How much do dietitian services cost? Like if I was, I don't know, the president of this school and I wanted to improve the quality of food in the cafeteria, because in my honest opinion, it doesn't taste very good. So how much would like their services cost? To, like to say, hey, I want to improve the quality of food here at my cafeteria for my school.
Well, and it depends on the dietitian. So probably you would just need a dietitian to consult. And what's the closest major hospital? Enid?
Shame, it's here now.
It's big, I mean, has a dietitian? I'm sure it does,
Yeah,
consulting
for
at
sure.
least. You may start there and just ask that person, if they charge to consult. It really is a sliding scale, there's no telling, but all you need is a consult to help with that. Is that truly a concern? Is this
Yeah,
really-
I would
okay.
really like to introduce them to the owners of our
Well, and what about your
cafeteria.
student groups, like a grassroots effort, to get your students rallied around to have a food
I'm
court?
sure, do y'all agree with me, disagree with me? Y'all like the caf? Does anyone need to eat in the caf?
I cook the food in the bathroom.
You're biased.
I mean, it's whatever.
I mean, you've seen it before it's cooked, so I can only imagine what you.
Doesn't look,
Mashed potatoes,
she's looking.
sometimes, most of the time, yeah.
So good.
But that can certainly be done. Any major hospital will have a dietitian either on staff or consulting with their patients.
Go to SGA and voice.
Do you have a question?
Are all your degrees terminal? So like I got a bachelor's in nuclear medicine, are there any other institutes that would allow me to go on for a master's or a PhD?
Well, in nuclear medicine, no. But a lot of our students that want to pursue management in a hospital may get like an MBA to something that complements their career goals. Now, radiation therapy, there is an advanced degree of those medical imaging, and that's the medical dosimetrist. So that's the person who has the physics knowledge to map out the plan of care that the radiation therapist is delivering to the patient. So we do have that program for radiation therapy, and that's medical dosimetry. That is absolutely no patient care. You are solely working on the physics behind the radiation that you want delivered to the patient. Critically important person on that healthcare team. But that's the only one of those medical imaging where there is a clear ladder within the profession. But the others, it just depends on your goals. And some decide they want to go teach. So they want to come back to the college and teach. So they may pursue a master's of education, maybe ultimately a PhD. It just depends on what your goals are, and then you align that education with what you want to do. All right, now I have one final question for you all. I am actually one of these allied health professionals. So I practice as one of them. Can you guess what it is?
Speech pathology?
It is not speech path, but that's a good guess.
Occupational therapy?
Yes, how did you know?
I don't know, you're nice.
Well, all these professionals are nice,
I
right?
think it's because you said you liked his definition, so you showed your interest in it.
Oh, I was too energetic about that one. I try to be energetic about all of them. But yes, I am an OT, but I love all these professions. Well, thank you all so much. If you have further questions, if you want to play with the electrolarynx, I will be here for a few minutes. Thanks for being here
Thank
tonight.
you.
So why don't we give her a hand of thanks?